Hi, my name's Kay. I'm one of the intensive care doctors. I'm just going to go through some of the micro skills that are needed for central line insertion. First one, which is really important, is being able to advance a syringe whilst aspirating with one hand. So as James has shown you in our video from start to finish of inserting a central line, you initially, when you're going in using your ultrasound guidance, as soon as you're through the skin, you want to be aspirating whilst looking for your needle tip on the ultrasound as soon as you're under the skin. The importance of this is this acts as a second safety net for you to identify when you're in a vessel, okay? Sometimes people struggle initially visualizing the tip of their needle on the ultrasound screen, but you'll feel a loss of resistance and you'll get a sudden give and flush back once you're doing that. So it's important that you're able to, and again, just with one hand, aspirate as you're advancing. And so this will look something like this. There are different techniques. No one has an innate sense of how to do it. You just have to literally take a spare syringe, whatever, when you're in between ward rounds or when you're on the unit, and just see what works for you. Two different techniques. So one is holding the syringe between your index and your middle finger, like that, almost making a J shape. And then you're going to be using your thumb to advance or push the syringe as you're pressing down. So it just looks something like this. Okay? That's one technique. Another technique, again, which I find uncomfortable but may suit you, is holding the syringe, the plunger, with your thumb and your middle finger, and then this time using your index finger to push the syringe away, like this. And sometimes people find this method easier for if you're having to go into a vessel at steeper angles. And again, you'll be advancing like this, and hopefully once you're in a vessel, you'll be able to, again, get that loss of resistance. These are the two commonest techniques. There are others, and you might find your own, but it's really important, just again, as a safety net, to be able to do that with one hand without having to insert, then aspirate, just as one smooth motion. So, aspirating whilst advancing with one hand. Those are the two common techniques. You find what works for you.